Ensuring that a wound is free from infection is essential to a person's health. Clean is defined as being free from dirt, marks, or stains, whereas sterile is to be free from microorganisms. Aseptic techniques is the procedure that healthcare workers use to prevent contaminants from pathogens that can lead to infections. These techniques are common in various settings like surgery rooms, clinics, outpatient care centers, and other healthcare settings. Aseptic techniques are used to keep the patient from hospitals' microorganisms as realistically as possible. These techniques are used to protect wounds and other susceptible sites from getting an infection. Aseptic techniques are utilized during invasive medical and nursing procedures where members of the surgical team must employ good aseptic techniques, and the scrub nurse or surgical technologist must maintain the sterile field. Personal protective clothing, PPE, like gloves and eye protection, are essential to provide a protective barrier to prevent infection. There can be several reasons like advanced age, underlying disease, or severity of illness that the immune system can directly contact the person's risk of infection, which can include cross-contamination in the healthcare setting. Any break in the skin that varies from a superficial to an open wound. A scrape is the removal of the epidermis and the exposure to furthermore layers of the skin. Deeper penetrating would create a partial loss of the dermis, and severe would go through the full thickness of the epidermis and the dermis, and even deeper to the subcutaneous, the muscle tissues that allow the microorganisms to enter the body. Acute wounds occurs when it is a consequence of trauma and surgery. Blood clotting and wound repair will lead to closure, and the healing will take place within 2 to 4 weeks. The chronic wound is one that did not occur in an orderly or timely process and needs 4 weeks to heal. The vascular wounds and pressure wounds. Surgical wounds heals in an orderly and expected manner and is an acute wound. The primary closures or are left open due to primary closure or heat, but secondary closure. Infected wounds would never be closed. The PPE is to protect individuals from wounds, which can lead to infections. Since antiquity, people have been trying to prevent infections. Witchcraft and magic were popular methods to avoid or drive away disease. 3rd millennia BCE, Europe used pitched resins and aromatics to embalm bodies. Salt is an essential ingredient to maintain dry skin mummies and are still in good condition to this very day due to the ancients' knowledge of germicides. Millennia, 2nd millennia in the Bible, Leviticus, Numbers, and Deuteronomy had a system to purify infected people and to have a sanitary code, mainly by quarantine. In 550 BCE, Greek infantry would burn incense and sulfur for deodorizing and disinfection. They would also fight naked since they understood that clothing in contact with wounds could create more significant infections. During the Middle Ages, Arabian physicians applied mercuric chloride to prevent infection in wounds. In Europe, medieval personnel used burnt straws, fumes of vinegar, antimony, and arsenic to prevent infections. These procedures were harmful since the smoke and foul scents encouraged filth, pestilence, and plagues. Future sterilizers, called autoclaves now, called pressure cookers at the time, were invented in 1680. The devices used air by heat and used to expand. However, the air is entrapped within a closed system. The superheated steam in the cooker trapped around the items. The increase of 15 psi pushes the water boiling point from 100 to 121 centigrade. The superheated heat within the stove circulates the objects within the container, penetrating and allowing all the items to be cooked rapidly and to destroy the microorganisms at the same time. In 1683, Antoine van Leeuwenhoek, a Dutch linen draper, develops the microscope and also proves the existence of the microorganisms. Modern-day concepts of asepsis uses the 800 idea of people on the importance of washing hands before delivery to reduce perpetual fever. Pasteur further influenced the ideas by suggesting that carbolic acids should be used as an antiseptic to reduce the chances of illness. Microbial substances that are living on living tissue and skin to prevent infection or sepsis. Modern-day concepts of asepsis uses the 800s idea of the importance of washing hands before delivery to reduce perpetual fever. There is Gustav Adolf Neuber, who is considered the inventor of the aseptic. He enforces the rules, ensuring that the cleanliness of the rooms and the surgical instruments. Staff surgeons were required to wash their hands, face, and arms before performing procedures in their surgical rooms. The conference at Berlin, the International Medical Conference, over 7,000 delegates shared medical stories. Berman took a group of a tour in his clinic to show them the rate of healing attained by the aseptic techniques. In 1825, hypochlorite was used as a treatment for open wounds, followed by iodine in 1839. The improvement of life through the aseptic techniques began with the golden age of microbiology. It took a gangrene outbreak and multiple deaths of pregnant mothers for the aseptic techniques to become law in the hospital environments. Washing hands with water and alcohol were commonplace in the 1890s, but the introduction of surgical gloves further decreased infections. William Stewart Halstead of Johns Hopkins University gave 2 pairs of gloves for each scrub nurse due to the allergic reaction to soap. He noticed that the infections were decreasing, and so he had all his surgical team wear gloves. There's controversy between the deception of clean versus aseptic. The terms have been interchangeable, and that they are used as individual interpretation. Surgical asepsis is necessary for any invasive procedure. It requires sterile scrubs, sterile gowns, sterile techniques when handling material, clean for clean and sterile for sterile. They reduce the number of pathogens, referred to as a clean technique, and used for the administration of medication, aminos, tube feeding, and daily hygiene. This is hand washing as number 1. This is medical asepsis. Surgical asepsis is the elimination of all pathogens. It's known as a sterile technique and used in dressing changes, catheterizations, and surgical procedures. Clean techniques ensure the object of interest free from visible soil like dirt, marks, or stains where there is, to reduce the amount of patient exposure to overall microorganisms and to prevent the lower risk of transmission. Sterile to sterile technique applies, but they are used in the long-term home care and clinical settings of patients that are not in the high risk of infections. Clean techniques reduce the amount of overall patient care exposure to microorganisms and to lower the risk of transmission of diseases and to prevent infection. The movement of objects from sterile to sterile location applies, and these techniques are used in long-term health care and clinical settings of patients that are not at high risk of infections. Cleaning an item is to reduce the number of microorganisms from being transmitted between locations. Clean techniques includes washing hands before using personal protective equipment and keeping the surrounding area as clean as possible. Washing hands vigorously and maintaining a clean environment applies to places like long-term care facilities or clinical settings. There's a low chance of patients from being infected. Medical professionals will keep their environment as clean as much as possible to prevent infections. Some situations require aseptic techniques, while others use clean technologies based on the medical discretion on the best method for the patient's health and welfare and what is most economical in money and time. Common clean techniques are used when they are injecting a patient, emptying a urinary drainage bag, inserting or removing peripheral IV, wiping down tables with non-toxic chemicals, or removing a urinary catheter. Sterile techniques indicate that the object is free from microorganisms and the involved procedures, medical tools, medical personnel is used in inpatient care can reduce exposure to microbes. The sterile techniques require careful hand washing with specialized solutions, knowledge to use a sterile field, and the use of sterile gloves before, during the application, both sterile dressing and the method of sterile instruments. They must be aware on how to work with a sterile field and that the dressing procedures and avoiding contacts with a sterile field or a non-sterile surface or products. The medical professional sterile technique is practiced in medical centers for patients under constant risk of infections, operations, and wound debridements. Sterile items must remain sterile during a medical procedure to prevent infection. All medical practices focus on the elimination of pathogenic and non-pathogenic organisms. The principles to maintain surgical asepsis includes sterile items within a sterile field, gowns within the sterile in the front and chest to the level of the sterile field, and sleeves from 2 inches to about below the hip. Sterile personnel must only operate within a sterile field. Gowns considered sterile is a rectangular area within the medical employee's interior, and from the superior area at the head to the chest to the inferior area at the hip level. The medical personnel's lateral and posterior areas are not considered sterile. The sterile field includes sleeves, 2 sterile gloves. Sterile personnel can only operate within the sterile field. Scrub staff should have protective personal equipment and remain gloved. Every material in contact with the wound and within the sterile field should be sterile. Sterile drapes are used to create a sterile field. The superior portion of the drape table is considered sterile. The draping should be surrounded the surgical area and is placed in the front to the back. Surgical items are displayed and organized to preserve sterility. Movement of the surgical items are to the transferred objects by only 3 methods: from the sterile field to the sterile field, from sterile to unsterile field, and from the sterile to the unsterile field. When an unsterile object touches a sterile object, the sterile object is contaminated with bacteria and oil. When an object is packaged, the outside of the package is contaminated, while within the special barrier, the inside of the sterile container is sterile. This sterile asepsis is maintained by observing other medical personnel to ensure that sterility is preserved. The circulator must be aware of any breaks in the sterile technique. All sterile packages must be observed before opening for holes and cracks. The holes allow microorganisms to enter the sterile environment and contaminating them. Personal effects like hair must be completely covered and keep talking to a minimum. The circulator must always be aware not to touch nor reach over a sterile field. Face sterile areas when passing objects, and be mindful not to pass an object between 2 sterile team members. Hands must be vigorously washed for 15 minutes to break the chain of infection before and after handling patient's piece of equipment and prior to and after patient contact. Never touch the edge of the cap or lifting container when sterile solution is poured. Contact the sterile field minimally. Keep the sterile fields as dry as possible. Never lower the sterile instrument beneath the hip or medical device or procedure. Then it is considered contaminated, and decontaminate the floors and walls after soiled medical use with disinfectants. Bacteria and viruses can survive in surrounding environments depending on the type of environment. Generally, viruses can survive for longer on non-porous substances like stainless steel, plastics, as opposed to fabrics and tissues. Rhinoviruses can survive 40% and can be infectious on hands after several hours. MRSA can survive for days on dry, hard surfaces. Herpes virus requires direct skin contact or contact to another individual. The microorganisms that can be harmful to the body are numerous and everywhere. These organisms include viruses, bacteria, protozoa, fungi. The destruction of the microorganisms is to prevent the introduction of microorganisms that promote infections and fevers of the host. There are microbes all over the body and the skin, the gut, mucosal membranes. Although there are beneficial microbes that can harm host microorganisms, can infect the host by damaging cells within the body. As the cells get damaged, signals within the cells are given off, and the immune system, comprised of white blood cells and antibodies, will work to remove the foreign invaders. Some symptoms of these hyperactive immune systems include symptoms like fever, malaise, headaches, rash, and as a result of the immune system attempting to eliminate the infections within the body. Failure to destroy the organisms can include sepsis is the body's response to injections, injuries of their own tissues and organs, including fevers, increased heart rate, increased breathing, and confusion. It usually affects the very young or the very old, or people with compromised immune systems. Severe sepsis is when there is poor organ function due to reduced blood flow. The body response is usually an immune response due to an infection. The pathogenic microbes can infect the body by killing cells or disrupting cellular function. Bodies will increase the temperature of the host, creating fever to inactivate scores of viruses, or using interferons to prevent the replication of the viruses, or using antibodies to tag the invader. The bacteria will make people sick, since the number of replicating bacteria will overwhelm the host tissues and disrupt normal function. The number of bacteria cells that will kill cellular tissue and paralyze or destroy the cell's metabolic machinery and create an immense immune response that is itself toxic. The bacterial cells produce waste toxins that could paralyze metabolic machinery. The viral or bacteria can live on the surface for several hours, which is why washing hands is essential. The biological effects of using aseptic techniques in the devices are used to prevent picking up microorganisms from the surface, including patient's skin or environmental surfaces. The medical equipment is sealed in order to avoid pathogens from lying dormant on the surface of the tools. The tools can act as a vector for entering the body. There's equipment that is wrapped in special containers that people can use aseptic techniques when handling surgical equipment, helping with the birth of a baby, handling dialysis catheters, inserting chest tubes, inserting urinary catheters by inserting a central intravenous or arterial line, or performing surgical techniques. That infection causes the body to undergo psychological changes such as fear, excessive fluid draining, nonspecific pain, redness, swelling. Hot sites on the body usually means there's an infection that has occurred when the cell's body are damaged. The host immune system is trying to get rid of infections, creating symptoms such as coughing, diarrhea, fatigue, and muscle aches or coughing. Of the more significant symptoms includes difficulty breathing, coughing over a week, fever with headache, rash, welling, or visions, or having a prolonged illness. Healthcare providers must use sterile equipment and sterile instrumentation to prevent the spread of infection. Material is first cleaned and removed any bioburden like oils or pieces of tissue. Once cleaned, the bacteria-killing applications like using a sterilizer on the instruments or applying alcohol upon the patient's skin before a procedure. Nurses must also have proper use and removal of PPE, followed by hygiene to reduce the multi-drug resistance. Healthcare workers should also be aware that they can pick up environmental contaminations of microorganisms on hands and gloves even without performing patient care. Identify aseptic and infection control parties can reduce the dissemination of organisms to a single patient and prevent the repeated transmission that can create an outbreak among multiple patients. Techniques provide necessary healthcare services include not to work what is having an infection illness, to be knowledgeable about the methods to prevent the patient from transmission of the disease, to perform aseptic practices, and to monitor the patient's infections, and to participate in the quality improvement in order to reduce infections and to provide care even if there's self-risk in infections. Healthcare providers must use sterile equipment and sterile instruments to prevent the spread of infection. Materials first cleaned to remove any bioburdens like oils or pieces of tissue. Once cleaned, bacteria-killing applications can be used, like using a sterilizer in the instruments or applying alcohol on the patient's skin before procedure. Nurses must also have the proper use and removal of PPE, followed by hand hygiene, essential to reduce multi-drug resistance. Healthcare workers must also be aware that they can pick up environmental contamination of microorganisms on hands and gloves, even without performing patient care. Identified septic infection control can also reduce dissemination of microorganisms to a single patient and prevent repeated transmission that can cause an outbreak situation among multiple patients. Techniques are important to provide safe health care include not working when there's an infection or illness, to be knowledgeable about the methods, and protect patients from transmission of diseases. Sterile means it is free from bacteria and microorganisms. Sterility means there is no viable life. Sterilization methods can include electrical or gas heat, chemical treatments, or radiation. Purposes of maintaining aseptic sterility includes barriers, patient preparation equipment, environmental controls, contact guidelines. Devices subjected to sterilizing can include aseptic techniques, including central line, surgical equipment, and people like scrub nurses or surgeons that have sterile barriers and should only be touched only other sterile items. In conclusion, surgical and site infections are common nosocomial maladies. Medical staff must remind that infections are responsible for extended hospital stays.